Hi, ACR Converge 2020. I'm Dr. Rachel Tate coming to you from my family's home outside of Louisville, Kentucky. We've already addressed treat to target for AS patients, so let's switch gears a little bit and I want to discuss treat to target for psoriatic arthritis patients. A systematic literature review out of France, this is abstract number 0321, found 673 psoriatic arthritis articles. Of those, they chose 73 to analyze that represented actually 27 PsA cohorts. And they found that outcome measures, much like this disease, are very heterogeneous for this patient population. Thus, we actually need to define treat to target better in psoriatic arthritis. In addition to this, there's another article I wanted to share with you, but this one's from the US. It's abstract 0324. This showed further difference between those patients who are enrolled in randomized clinical trials versus clinical practice. So again, outcome measures also were found to be different. This makes real world and of course choosing between outcome measures for trials therefore very difficult. A retrospective analysis, abstract 0320 out of Israel this time, used MDA and DAPSA scoring to determine outcome measures in general for our psoriatic arthritis patients. And this actually showed that only 65% of the cohort that were evaluated for these treat to target measures. So of the entire amount, only 65%. So I really think our main obstacle in treat to target implementation for psoriatic arthritis is actually defining what treat to target measures are. So until we have validated practical disease activity scoring and agreement amongst all of us, it's going to be difficult to make treat to target implemented within our patients, rather in clinical trial or in clinical practice. Shifting gears just a little bit, but still very important to this topic, abstract 0344 suggested that BASDI scoring, which as you know is originally used for axial disease measurement in AxSpA, it showed similar scoring in PsA patients in terms of responsiveness, a change in score, and overall scoring in general. And this is regardless of axial involvement. So it kind of makes sense given that only 5 out of the 6 scoring measures are not specific to axial involvement at all. So the question really for me is, will this be something for the future? Is this an option that we can look at for clinical trials and hopefully even in clinical practice? So given the importance for treat to target and rheumatoid, there's no doubt that we will all benefit from having treat to target measurements for our patients in spondyloarthritis and PsA and AS. But I really think that the difficulty is going to remain that we need to determine best measures considering the varied domains and the clinical presentations of these diseases. So stay tuned for all of your ACR 2020 updates at rheumnow.com. And of course, follow me on Twitter at UpToTate.